My Missing Piece, a collection of stories from amputees for anyone navigating loss, reclaiming strength, and redefining possibility. The Amputee Center and Ohio University's College of Health Sciences and Professions are proud to collaborate in launching an innovative podcast series that highlights resilience, empowerment, and community. This partnership unites expertise in education and rehabilitation to amplify the voices of amputees, share inspiring stories, and foster meaningful conversations on accessibility and well-being. By leveraging the Amputee Center's deep-rooted commitment to advocacy and CHSP's studio resources, this initiative will serve as a platform for education, inclusion, and support for individuals navigating life after losing a limb. We are excited to bring this vision to life and create lasting impact together. So today we have with us Carrie, and she is, what are you, right hand amputee.
Right hand, finger amputee.
Yep. So upper extremity, which she's our second one in the collection of stories. So thank you for being here. And we're excited to get this library together so that we can help others through their journey of amputation. So what I like to start off with is to really just talk about you. It's a whole time is about you. So I want to just spend some time talking about your life before the amputation.
Okay. So I went to Marshall University and got my undergrad bachelor's degree in nursing, and I worked in Charleston, West Virginia. Started out at Charleston Area Medical Center General Division on neurology. I hated it. It was like a nursing home kind of feeling to me. Basically, I just passed out meds and helped people bathe, but you had to start out on a floor job before they would let you do like the ICU or emergency care nursing, and I wanted to do emergency care nursing. I did neurology because my uncle had actually died in 2013 at the age of 46 from a brain tumor.
Mm.
So that kind of led me in where I thought I'd start. But after about a year, since I really disliked it, I thought I have to go on. I have to get my degree to be a nurse practitioner because I don't want to do this job for the rest of my life. So I did switch locations and I worked at Women's and Children's ER in Charleston, West Virginia for about 4 years, while I was also going to school part-time through Marshall University for the Masters of Nursing program, which I could do virtually, like through a special location that they'd have in different areas of the state. You can also be on campus for it. But they required that you worked full-time while you did school part-time. And so it was actually kind of nice because I could pay for it as I went, unlike my undergrad. But when I finished that, I was also kind of ready to leave the ER, not because I didn't like the job, because I loved it. Like I got to do all the skills I learned, got to see a lot of people, take care of kids. But moving forward, I was just not a fan of the management. And I think it's more the hospital system setting than anything else. And so I went ahead and quit that job before I had a new job. And it took me about 9 months to actually find a nurse practitioner job in West Virginia. There were a lot of people applying. I applied to like 6 jobs or so and did interviews and everything and did not get the job. And so, I had to start making more money again, of course. So in November of the same year, I left my job in September. I decided to move up to Parkersburg, West Virginia, and I worked as an RN on the pediatric and postpartum area in Camden Clark Medical Center. And as I was working there, I was still looking for NP jobs. Everyone kept asking me why I was there. since I had my nurse practitioner degree. Um, but like nothing happened basically. I couldn't get any callbacks for like local hospital options. I talked to the pediatricians that worked there, possibly working at the hospital, but I just didn't really know everybody.
Mm-hmm.
And then at one point, it came to be that I got an interview for Planned Parenthood, which is in Vienna, West Virginia. It is the only Planned Parenthood in West Virginia altogether. Uh, I didn't really know a lot about Planned Parenthood overall, I guess, at the time. I knew they did women's health, like birth control,
Mm-hmm.
you know, pap smears, that type of thing. But, most people associate it with the abortion
Mm-hmm.
side of it, which is never ever been done in West Virginia because of the rules behind it. But that's just an FYI.
Mm-hmm.
But I did have people ask me, they're like, they do abortions there. Okay. They also do a lot of other
Mm-hmm.
healthcare things for people, and people that don't have insurance, or don't meet like the pay qualifications to purchase their own insurance, or they
Mm-hmm.
make too much to qualify for Medicaid, where a lot of people fall in West Virginia. They help out, doing, again, preventative visits, breast exams, pap smears, birth control of all types, implants, IUDs, pills, patches, all of it.
Mm-hmm.
And we also do a lot of STI, sexual transmitted disease or infection, uh, treatment and testing.
Mm-hmm.
And then as I started, another thing I had no idea about was gender affirming hormone therapy, which is for patients that are wanting to transition to the opposite gender that they were assigned at birth. And I was asked about a month into the job if I would be comfortable doing it.
Mm-hmm.
And I said, sure, why not?
Mm-hmm.
It's just something I don't know about.
Mm-hmm.
So I had the training. And so I had started in April of 2020 at Planned Parenthood. And then it was June of 2020 when we started seeing gender affirming patients for the first time
Mm-hmm.
via telehealth, also
Yeah.
because of
So it's 2020.
pandemic times. Yes.
Mm-hmm. Yeah.
So it was a really wild time to I was still working at the hospital part time also.
But you went from thinking you were going to do neurology to being on a birth floor and
Yeah.
women's health to
Yeah.
basically.
And I really had wanted to go into pediatrics, but I really did enjoy my women's health
Mm-hmm.
rotation as well in school. And so it's not something I had ruled out necessarily,
Mm-hmm.
but I did get my family nurse practitioner degree. So I thought at least I'd have options for locations that I could work. And so it's kind of wild because I'm also the only provider that works there. And so starting out as a new nurse practitioner, because most places want you to have experience, but how do you get a job without
Without experience.
experience
Mhm.
was the biggest problem I was having with some of the things I thought I'd like to do.
Mhm.
Was that, again, I was the only provider. We're the only one in the state. The other providers are in Virginia, North and South Carolina. And so there was a travel NP that was covering basically for like the 3 days a week that they currently had open. And she taught me the basics of everything, but then I was on my own.
Mhm.
And so it was still one of those things that I experienced a lot as a nurse, as a learn as you go
Mhm.
type of situation.
Did you, in all of that time up until then, did you have any patients that were amputees?
No, actually, I hadn't
That's
seen any.
so interesting. Yeah, because that's always my question
Well,
too.
I mean, not as an NP,
Right.
I guess,
Well,
right? So yes, I did. I had a couple when I worked on the neurology floor that we took care of post amputation, typically in relation to like sepsis or diabetes. I had a couple that were leg amputations.
because I usually, yeah, a lot of what's interesting is the correlation or other upper extremity amputee is also a nurse. So it's like wild. Like, both of you have had that medical experience before you
Right.
had your personal trauma medical experience. Um, but but as you like get your, I think as a medical professional, right? Like you're leading up towards that, and I think that helps to build in with the empathy of navigating, like you
Oh,
were saying,
absolutely.
navigating the system
Right.
because amputation is actually, the longer I spend in this job, like seeing that there is a lot of amputees, but to go in to suddenly be in that category of disabled or whatever, and then to never have had that experience or met somebody before is like that's the purpose of these stories, of recording these stories.
Right, and so in the hospital, you typically see somebody right after an amputation, and I mean, you do see the psychological side of whether or not they're ready for it, even if they, like, absolutely have to have it.
Mhm.
It's kind of like, have they accepted that they are having it, and are they ready to work towards,
Mhm.
improving things or living life in a new way, or are they just in complete denial, and they're just upset, and they
Mhm.
don't have a good outlook at all.
And our purpose at the amputee center of like what are we working to provide, and then seeing those holes in the system of like preparing somebody pre-amputation if they
Right.
know it's going to happen, talk to other people, somebody come to you after your surgery that, peer
And a big
support.
part of that is I don't think there's enough resources at the hospital for any home care after. Like, what are you supposed to do after you leave the hospital or
Fresh
after
leg.
you leave, yeah,
Right.
the nursing facility that you have to be in? There's not somebody typically
Mhm.
at most places that's going to go to your house and work to make sure you have, say, a ramp if you needed one, or easy access, no fall risk, all the things to get where you need to go as you're learning to walk again,
Mhm.
or just live life without a part of you.
Right, right.
Um, I
So
think that's unfortunate.
so you moved up here in 2020 to Parkersburg?
It was 2019,
Oh,
November 2019. Yep.
yeah.
Yeah.
Yeah, you jumped right in.
And it's wild because it's like I was always meant to be here,
Mhm.
is how it felt.
Mhm.
Just because I've made more close relationships, I'd say, with people than I ever did when I lived in Charleston
Mhm.
for the most part.
So what year did your accident happen?
It was 2021,
Mhm.
and it was September 25th of 2021. And so that was also a wild experience being in the hospital during COVID,
Mm.
where nobody could come in with you. Like, you had to wait a long time because all of the respiratory patients were taking priority because of all
Mhm.
the fear
Mhm.
that was going on.
So, um, we'll switch gears a little bit. Let's go to uh the the days before your amputation or the day of and how
Yeah.
what was life and what were you doing and
So I had actually picked up another NP job as a private contractor, basically, to go to patients' homes and do assessments for Medicare. And that was completely virtual for training and everything else. The company is called Signify Health, and they are out of Texas. And they would send you everything, all the tools you needed, the iPad you needed to document, and they gave you a list of things that you would need. So I was actually at that time working 3 days a week at Planned Parenthood, and the other like 2 days I was doing full time traveling to
Mhm.
people's homes around the area
Mhm.
to do these assessments. And the day before is pretty vivid in my mind because I went to a home in the middle of nowhere, and I don't even remember where it was, but they had this tall bridge to go across, like over a creek type thing.
Mhm.
And you had to park and walk across to get to their house. So it was a little nerve wracking just because you don't always know how well kept up
Mhm.
bridges and things are. But the man I met that day said he was the turtle guy, and that's something I'd never heard of. But apparently he has his own online show.
Oh.
And it was it's just a whole different experience, right? I mean, it's very neat meeting people in different areas and
Mhm.
kind of hearing their stories
Well,
about
it's Appalachia, so.
right about what they do. But that was one of the, I guess, wildest locations
Mhm.
I had been in. But they had access to everything
Mhm.
as you normally would. You just can't get to their house without walking across this bridge. So
Mhm.
you had to park on the road at the top.
Mhm.
Uh, and so that was interesting, of course. And like I remember, I hit my hand on the bridge, like part of it, and I'd cut my hand where I hit it, and it was
Mm.
I was like, well, I've had a tetanus shot in the past 5 years, so I
Mhm.
should be good. Um, but I remember that too because I was
Mhm.
thinking, oh great,
Oh, great! I injured my hand.
yeah, right, exactly. Which again is ironic at this point, but so that was September 24th. That would have been a Friday, and then September 25th was a Saturday. So that day, my current boyfriend and I decided to go on the four-wheeler at his grandparents' farm area out in Caro,
Mhm.
uh, West Virginia. And it took about an hour and a half to get out there, and that's only important to know because of later.
Right. Yeah. Yeah. Medical.
Yes.
Mhm.
So I hadn't been on a four-wheeler since I was in high school, and I think I rode with one of my cousins.
Mhm.
It's just not something I did, not something I was super interested in necessarily, right? But he really wanted to go and thought it would be fun. So they have like this big area where a farmhouse and like a fire pit type thing, but they didn't have animals.
Mhm.
And so we had actually been riding around all day. And one of the wildest things to me is I had actually been thinking, don't put your hands on the back bar. Don't hold yourself with your hands
Mhm.
on the back bar because of all the injuries I had seen in the ER. And it wasn't that I felt something bad was going to happen. I just thought, shouldn't do it.
Yeah. You.
I don't know. It wasn't like I predicted it happening, but it was later in the afternoon, probably close to 4. We had gone out in this area, and he wanted to go up this hill that was kind of steep, and I felt like I was slipping because I was sitting on the back end, and there is this almost luggage rack type metal bars
Mhm.
that I was, sitting on partially.
Mhm.
And because I felt like I was slipping, I did put both hands on the back metal bar with like fingers wrapped around because I thought I was going to fall off. And so he backed up because I asked him to.
Mhm.
But during that, my right hand or fingers got pinned between the bar and a tree. And the irony is that the tree wasn't even very wide. Like it may be softball size around, but it just hit the right spot.
Mhm.
So I screamed. He thought I screamed just because he hit something and shock or whatever. And he was like, "Oh no, your hand." And then I thought too, that was the worst pain I'd ever experienced in my life.
Mm.
And I thought, how am I going to get my hand out? Like I didn't pull it,
Yeah.
but I just thought, what am I going to do?
So it like it. He stopped it, and so your hand. So you were pinned between the
Yeah,
tree.
yeah. He had stopped, and
Mm.
and it really wasn't. It was only a few seconds,
Mm.
but it felt like a lot longer. And he pulled up, and immediate like relief of that horrible pain
Mhm.
went away. Right,
Mhm.
I still had pain, but it wasn't anything like it was. But I pulled my hand around, and I could see the bone in my ring finger where the skin had been pushed to both sides, and I couldn't even see my pinky, which is part of the wild. Like there was blood everywhere, and
Mhm.
I didn't even see it. So I don't actually know what it looked like at that time.
Mhm.
And so I just immediately said, I need to go to the ER. Does that initial, I gotta go. My biggest concern was actually infection. It wasn't thinking of losing a body part or, this,
Mhm.
it's probably broken, but it can be fixed. Maybe thoughts, but more than anything, I just thought if I don't get to the antibiotics, this is an open fracture and it could get infected
Were you
easily.
bleeding a lot at that point?
I was
Mhm.
quite a bit. I had a hoodie on, and so I was cradling my right hand with my left and like had
Mhm.
the fabric over my hand sort of thing. And I just there was blood that dripped everywhere. I remember that.
Mm.
It just kept dripping. And there was a pool of blood and like this big clot that had developed where I was holding my hand. And I was just like, oh no, this is bad. I even had
I
that.
think the perspective of a nurse too. Yeah, yeah,
Right.
yeah, where like maybe somebody else would be like, "This is kind of bad," and you're like, "No, this is really bad."
Yeah. Yeah. I mean, just because that amount of blood and just, seeing it, right? I mean,
Mm.
just, it was, I knew if the bleeding didn't stop, I was in trouble,
Mm.
basically. So I had gotten off and he had turned around the four-wheeler and I just had that nauseated feeling and that heat rush through my whole body, like kind of when you're just terrified of
Mhm.
something.
Mhm.
Uh, and the nausea lasted almost like the entire time.
Mhm.
So I get back again, still holding my hand. We get back on the four-wheeler because there's no other way to get back
Ooh.
to the farm area, and there's no cell service. So we didn't have our cell phones anyway, left them in the car.
Mhm.
And I just remember thinking, because the weather was nice and the sun was out.
It's okay.
Sorry.
Don't apologize. It's fine. It's a lot.
And I just remember thinking, I can't reach my parents, but they know how much I love them. And like a sudden calm just came over me, and I don't know exactly what it was. Um, but my boyfriend had given me his flannel shirt to wrap up my arm, so I tight as I could. I wrapped it and then, I tucked it in to my body and I was just holding on to him uh, as we were trying to get back to the car. And I don't know how long it took us to get where we were, but it took us maybe 10 minutes to get back.
Mhm.
Um, but he thought I was going to fall off and he just kept trying to grab my arm tighter because I couldn't use my other arm.
Mhm.
But we got to the car. We got the dog that was there too. Uh, and again, I said before, it took us about an hour and a half to get there. It took us about 40 minutes
Mm.
to get back because of how fast he was driving to get me
Mhm.
back.
So it didn't occur to you guys to call a squad, even from a landline?
No,
Yeah.
not really, just because the location
Mhm.
was really far out too, I think, and just thinking it would be faster maybe,
Yeah.
you know.
Mhm.
But it was also something like the shock of it,
Mm.
and you don't think of everything at the
Abs
time. But I do remember in the car, I was thinking about everything. I'm like, I have to call work. I have to do this,
Mm.
like everybody. And he's like, you don't worry about that.
Mhm.
Uh, but it's just those things that run through your
Right.
mind. But I felt nauseated the whole time. My hand was throbbing. We get to the ER.
Did you feel like you were gonna pass out?
I had closed my eyes, but not necessarily that I was going to
Mm.
pass out,
Mhm.
but tired and
Mhm.
just sick to
Yeah,
my
yeah,
stomach
yeah. Mhm.
kind of thing. So again, we get to the ER, and I'm not going to say which ER at this point, just
Mhm.
because it was not a good experience.
Mhm.
But we get there, I tell them what's going on, and then I'm triaged, and my boyfriend, of course, can't stay with me, but they can come back once you get a room.
Mm.
So they unwrap my hand in triage, and the blood starts dripping on the floor. And I apologize. I'm sorry. I'm sorry. They're like, it's okay. And they're like, you're pretty calm for this kind of injury. And I'm like,
Mm.
well, I just know it has to be fixed. Like, I had to be here. And I was just trying to keep it together. And I think shock
Mm.
was another part of that feeling
Mhm.
and just not really knowing how to proceed, sort of thing, in that situation for myself at that time. And I don't even know what they triaged me as, but my blood pressure was elevated, my heart rate was elevated. And so I sat in the waiting room for an hour before I had an x-ray. And then I waited another 2 hours before I had a room.
Mm.
And by the time I had a room, I did think I was going to pass out, and I thought I was going to pass out because of pain. Uh, and I think it was the swelling and like nerves had been severed, which of course I didn't know everything at the time, but the swelling I think had just caused so much pressure that it just continually got worse over time. I thought I was going to throw up. I even went to the bathroom. I didn't throw up, but I really wish I had made like a bigger deal of it that day than I did, but I just knew
They hadn't give you any pain meds at that point?
no.
Oh, yeah.
Yeah, nothing. So I hadn't had anything, and it's been like almost 4 hours before I get back
Bleeding.
there
Yeah.
and bleeding. Yeah. Um and so my finger was never falling off. The pinky was not falling off. It was swollen and it was sitting like it was obviously messed up and it was sitting on top of my ring finger after it had been wrapped with the shirt when I got there. And I remember the ER doctor said he used to be like a military medic, actually, and he was trying to lighten the situation, said, well, if you were in the field, they just patch it up and they'd send you right back out. Uh, and it was nice the way he was handling things. So I saw my nurse 3 times during this visit, and I was in the room for 3 hours before I got to go home. And the first time was to put my blood pressure cuff on to get vitals. The second time was to get an IV pump out of the room for another room. And the last time was to get my shot of antibiotic, even though I was supposed to have an IV before that to get the antibiotics. But I was ready to leave. So the ER doctor had actually done everything as far as soaking my hand, getting all the stuff together to numb my fingers, to do the stitches. The x-rays were bad and I needed to see a hand specialist, but nobody was on that weekend. So the option was to possibly go up to a different hospital, but I was also told that they couldn't, I'd go through the ER and it could be another very long wait. And I may not even see somebody until Monday. And it was Saturday. So I was like, I'm going to leave. And I don't know that it would have made any difference at this point, knowing what I know now. But I followed up with the plastic surgeon on Tuesday. So that was, going on 2 to 3 days later. And when he unwrapped my hand, like I couldn't see my hand because of the way it was wrapped. Like I didn't see it at all after the stitches initially.
So you left the hospital on Saturday and went home
Yes.
and just like was taking like Tylenol? Like
So they prescribed antibiotic for 14 days. I believe it was 14 days. So longer than typical, but I had open skin and everything. And they prescribed Toradol and the antibiotic. And so, that's also different now because of all of the drug pandemic type things, of course, with opioids. But it was just Toradol, which is kind of like a stronger version of ibuprofen. It worked okay, but I mean, it was kind of wild that's what I was given. I mean, but I was so grateful for my fingers being numbed because that was the best thing that could have happened to stop that severe pain.
Did they gave you a local for the numbing?
Yeah, a local.
Yeah.
Yeah, anesthetic. So they numbed the base of both fingers to make the entire finger numb, basically. But I actually was able to feel the last stitch that was at the base of the pinky on the external part. And I told the doctor he numbed it more, but I could still feel it after. And I was just like, I'm ready to be done. So I wasn't worried about it at that point. And again, at that time, we did not know anything specific about the finger, just that it was pretty smashed up internally. And I had a break also in my ring finger. But when I went to see the plastic surgeon that Tuesday, took off the wraps, and the tip of my pinky was starting to turn black in the central top part of it. A small area, and I just started crying because I knew it was bad. And he asked me, well, did they do what they call capillary refill check? That's where you squeeze the finger and see how fast the blood comes back. Well, they did, but I don't know if you could tell because there was so much bruising
Mm.
and swelling at the time. Like, I don't know if there was a color change even. But I remember the doctor doing it. And he's like, was it wrapped too tight? I was like, I don't think so. So it's kind of wild. So he said what could happen is the tip of the finger might die and kind of be like mummification, is what he called it. And so it would kind of die off on its own and kind of come off maybe on its own later. But we discussed, I had to go to surgery to pin the pinky finger to get the bones to align correctly. And so that was 2 days later, and that was on September 30th, Thursday, and that was my 32nd birthday.
Oh.
So I always joke, all I got for my birthday that year was a pair of hospital socks. And it was okay. I actually had a cousin who has since passed or died, but he took me, and he's in his 60s. He's like a second cousin. But he took me that day, and he told everybody that it was my birthday at the hospital. So that was nice of him, and a little more attention for that.
Yeah.
But I had surgery. The pins were in. But I remember at the follow-up, the doctor said he's surprised my finger was even attached because when he was looking at it, it was only connected with the outside skin. And so I'm not sure why we didn't do something different at that point.
Mm.
But, I'm also like, I'm not a surgeon. And, I don't know exactly. But what we did is we watched it. And it was 11 days after the first surgery that I had the second surgery to remove the pinky because it was dying. Basically, the color was continuously spreading, like the change in color, and the blackness was my entire pinky top at that point. And so that was a Friday that I went in for that. And so I knew for that weekend, and I had to go in on that Monday, October 11th of 2021. And
That's Lily's birthday.
yeah,
We were in the
wild,
hospital at the same time.
which is crazy.
Yeah.
But for different things, of course, but both a little traumatic.
A little bit.
But, I cried a lot at that point because before that, it was kind of like there's still hope until someone tells you there's not. And I think that might have been harder even than if they had just went ahead and taken it off initially.
And I hear that a lot, where, you go through and the medical professional says, let's try this. And so you do. And then in hindsight.
Right. And I had even started a daily aspirin to thin the blood to see if that would help. And I understand that sometimes with like crushed injuries, you can't always see maybe everything really well to know what's happening. But I just feel like if he saw that it was barely hanging on, that obviously, and I did forget to mention, the 3 hours later after the doctor unwrapped my hand, it was still bleeding. It was actively dripping blood.
Oh my gosh.
So, I mean, that was a sign of arterial blood loss. No one checked my hemoglobin or any of those things, for blood loss. And everyone was wearing masks. So I don't know how pale I, looked compared to, but I mean, I feel like I probably lost a pint of blood, which is not enough to make you pass out necessarily, but enough to make you feel bad.
Yeah. And not be able to make good decisions.
Right.
Or to be able to.
Right. I mean, I just remember being completely quiet most of the time. Like I would talk some, and I remember trying to make small talk with people in the waiting room. But in my mind, I'm just like, I want to get a room. I want to get a room. Let me get through this, talking to myself. because of the pain.
Yeah, pain, trauma, blood loss, like, and to be able to advocate for yourself is hard even
Right.
on a regular day.
Right. And
But then
so,
you
like,
add
I
all that.
definitely didn't do possibly what I should have done, but I've also worked in the ER, and I didn't want to make a fuss because I do understand that there's other things going on.
Mhm.
But in a situation with open fractures, it is really important to to get it looked at and antibiotics and that sort of thing. But
You're like, by the way, if
yeah, I mean, I don't know, and I don't know why it was so crazy, but it was. And the plastic surgeon didn't really know what information to give me
Mhm.
after. I had a lot of questions. And like I had a lot of phantom pain because the nerves are just cut suddenly. And sometimes that causes more issue than if you had another disease that maybe slowly,
Mm.
turned into like dead tissue or neuropathy with diabetes where you don't feel as much.
Mhm.
And I still feel some to this day, sometimes, some pain,
Mhm.
but more so sensations like
Mhm.
tingling or itching,
Mhm.
which I guess won't ever go away necessarily. I mean, it's hard to say. Uh, I know everybody's experience is different with amputation, but basically, I was told, well, it'll get better and you'll know about where it's going to be in about a year.
Mm.
I also asked about pain medication and not like opioids, but I know that Neurontin or gabapentin's the brand name usually, um, or vice versa, but is used for nerve pain.
Mhm.
And so I asked about it, like, would it be good to be on that for a little while to help? And I was told, no, they don't do that for nerve pain. So
Mhm.
I don't know. I mean, like, I knew differently when he said that, but also I thought, well, I've never had an amputation.
Mhm.
So I don't
So
I
why
don't
did you
know.
go to a plastic surgeon?
Well, this plastic surgeon was actually a
Like to
hand
rebuild.
specialist
Okay, to like
initially, but
rebuild the hand.
now does more cosmetic surgeries,
Mhm. Yeah. So they were looking at more just the construction of the hand.
basically.
Mhm.
Yeah, and just trying to fix
Mhm.
what it was. I didn't have to have any pins in my ring finger. Luckily, it was pretty stable.
Mhm.
There were a couple fractures in it, but there were so many things that happened after that I just wasn't ready for. The swelling lasted a long time. It was probably 5 months before it completely went down to normal. And I was not able to straighten my ring finger out. And I was recommended physical therapy, which I did. And I wore a splint on my ring finger at night, probably at least a year, to
Mhm.
make sure that, it would straighten out at night. And I would also wrap it to get swelling down and massage it under warm water to stretch everything out so that it wasn't stuck.
Mhm.
And one of the things I remember is that when I worked neurology, like stroke patients, if stroke patients work afterwards and are optimistic and they do, again, the exercises and things, they get better. But if they don't and they just don't want to, or they just have given up, then nothing improves and they are kind of stuck with the limits that they have.
Mhm.
And I just kept thinking that when I was trying to move forward and make sure that I had as much use of my right hand still as I could
Mhm.
because I knew it was important. Because I definitely thought I would lose my job
Um.
at
Mhm.
one point,
Mm.
but it was amazing. Everyone came together because I didn't have insurance. Like I was paying for insurance at that time. I didn't have work insurance because I was part time, and coworkers donated their PTO.
Nice for
And,
that.
I still work at Planned Parenthood today. And they really work hard to keep their employees, which is different than something I've ever experienced in a job.
Mhm.
Uh, but, of course, that made me cry because I was just surprised, right? I mean, I had only been there a little over a year at that time. And most of them didn't know me because we are all in different states. And so I was just bawling because I was just couldn't believe like how much other people cared. And I did speak to one of the peer visitors from the Amputee Coalition because that was the only information at the time I could find online for amputees, like to talk to somebody about what was going on. And so they pair you up with someone and you can do a call, you can do like a video chat. I mean, if you're close enough at that time, though, again, COVID. So you couldn't, right? But you could do in person if you needed to. So we did a phone call, and she lived in Pennsylvania, and she actually was a previous ICU nurse who got sick and had sepsis. And so she lost multiple parts of each of her limbs. And, she could no longer do her job as a nurse, but she became an advocate for others like her. And it was a couple weeks after my amputation, and I just kind of didn't know what to do next. And she's like giving me just helpful advice and different things, but I felt bad because I know other people have lost more. But she told me that loss is loss, and I mean, any part of you that you no longer have is something that you're going to grieve. And I know we've talked about it before, but grieving is not just what's currently happening and what you lost, but what you may have lost for the future. And I just didn't know what my future held at that time. And she made a big difference talking to me. I don't remember her name even, but I just remember her talking to me, and that it really made me feel better. So again, I did physical therapy. Things were better. Pain had improved, but I had tried everything. I was using creams. I was trying magnetic bracelets. I was trying copper gloves. And some of it would help a little bit, but not completely. I wasn't taught any techniques. I read online, though, to do like the mirroring, and some of the stuff I just didn't think would work as well for me. So I didn't try everything, but I tried the things that I thought would help. I took a nerve supplement, and it actually seemed to help, and like it was helping repair the nerves as well, but it did help with the pain. So I was never on anything for pain except the initial meds after the surgery. And, for a long time, I just thought, well, this is how it's supposed to be. This is normal, right? I wasn't talked to about any future problems or who I would go to if I had any issue. I wasn't talked to about the prosthetist, which, I mean, I wouldn't necessarily need one for my injury, but I think, like, hands and arms aren't as big in prosthetics, I mean, it's bigger now than it was, but it just wasn't as much of a priority, I think, because you can still get around without an arm or hand or a finger, but you can't walk around if you don't have a leg. But you do smaller precision things with the hands. And so about a year ago, I started having more pain back in my arm and in my hand. And I didn't really know why.
So that's 4 years after.
It's been, about 4 years. But talking to other partial amputees, fingers, toes, different things, at the Amputee Coalition in
24.
24, yes. Because I want to say 24, but just like, is that right?
24.
In 2024, when we went to Atlanta, Georgia, I talked to a lot of them.
I was surprised also by the statistics for upper to lower extremities. Myself, like we were at that workshop together, and that information would never, I never thought about that, but it seems like the upper extremity prosthetics just maybe are more expensive and maybe gets lost in the need
Yeah.
that you do need
Yeah.
it.
Right. Um, and I think, also a part of that is we don't have insurance that will cover it as a need and not just
Mm.
as a want, which is unfortunate, but it's kind of where it's at this time. If you don't word everything exactly correctly, they will not cover it. Um, which I had looked into a prosthetic, and that was the same answer I got,
Yeah, right.
even following like the guidelines that were recommended. Um, but with the pain, I talked to others, and they all were on the run.
Which is what you had asked for,
Is what I had asked
and they
about
said no.
initially and was told no. And sometimes other things, right? Like if it would get really severe. Lyrica was one of them that another person was on. Like if it would get worse, they'd increase to taking that or move up to taking that. And it's wild to me because, again, there's just not a lot of information. But I found out about the amputee center in 2022 was the first time I had seen anything online about it. I had not heard anything about it previously, and I was trying to find, somewhere I could talk to people because I did have depression that I really didn't realize had set in until I started feeling better. And it was just a lack of motivation to do things. It's not that I couldn't. It was just kind of like a state of mind type of thing where I didn't really want to.
Which is a level of grief.
Yeah, exactly. Yeah, depression is one of the stages. And with grief, you don't go through every phase at one time or even ever finish going through all the phases of grief, maybe in your life. And I think that's important for people to know too, that like it can hit you out of nowhere any day, right? And I think the pain that I was having that started increasing from like once a week or once a month to more like every single day had me just thinking about the amputation all the time. And that was really bothering me. Not just the pain, but the like psychological aspect of it. So I did see Dr. Souza, who came to speak at our last Amputee Fun Fest this year, does a lot with osteointegration, with amputations, but more so in the lower limb. But he was kind of like my stepping block to figure out where I needed to go next because the experiences I've had so far with this in West Virginia were not what I needed.
And Dr. Seuss's at
OSU, yeah, Ohio State.
And I will say, marked in this time, that you do work full time as a nurse practitioner, and I have been trying to get you here to record your story, but you work all the time. But that you did, you just got stitches out today.
I did just get stitches out today.
Which is where last week I was thinking, if she's off work, I can grab
right,
her
that
for
would work
this.
perfectly.
Yeah.
And it did work out.
Yeah.
So I saw Dr. Souza, and he actually called in one of the hand specialists that works there as well. And her name is Dr. Shu, and they both did assessments on my hand, arm, and, we came up with a game plan, basically. And so we initially thought it was probably due to nerve impingement in the elbow and also the wrist based on some of the assessment that they did. But it was a bit of a process as well. So I had to postpone my initial, like my primary care appointment. So then I had to postpone my, trying to think of the word. Just blanking.
It's okay.
Referral. So
yeah, you had to get a referral.
yeah,
to be able
I had to
see
get a
him.
referral for my primary to see them. So that prolonged the process. And then I got the referral and I got in relatively quickly, I feel like, and had the
'Cause we
appointment.
just met him in April, and this is
Yeah,
September.
and now this is September. And so I saw them and we planned to do imaging. Initially, it's an EMG, which checks like the nerve conduction So basically, how fast electricity runs through the nerve to kind of see if it was slower at the elbow, possibly
Mm.
at the wrist. But this whole time, I was told too that it doesn't always show easily as much with the ulnar nerve, which is the nerve on the side
Mm.
of my arm that we are talking about. And so it showed a possible slowing
Mm.
of the electricity down the elbow. But that doctor recommended a neuromuscular ultrasound, which is something I hadn't heard of specifically, like
Mm.
looking at the nerves with ultrasound before. So that was scheduled, and that was another couple weeks, and then I had it, and it was kind of non-specific as well as to really showing anything. Like it was slightly over the guidelines of like levels for measurements, um, and couldn't really see anything specific in my hand or in my wrist. So I was kind of nervous. Like I was like, well,
Mm.
what am I supposed to do now? Like if this doesn't show anything, what happens? So I then had a follow-up appointment, well, my initial technical
Mm.
appointment with Dr. Shu, the hand specialist at OSU, and it was really good. I mean, very thorough assessment, able to reproduce all the things that would indicate nerve impingement at the wrist and the elbow, and it would explain why pain came back after 4 years.
Mm.
More, instead of just staying kind of how it was, which was mostly aching with weather changes.
Mhm.
So we had a game plan. I had a neuroma at my amputation site, which is a ball of nerves that kind of comes out of having a nerve cut. And that nerve was also damaged. And so she told me today at my follow-up to remove stitches that exactly where I pointed and we marked was where the neuroma was, but stuck in scar tissue. So she had to free it out of the tissue and cut off to the healthy part of the nerve. And what she did is she reattached it to a nerve coming from the muscle in the lower part of my hand. And they use what they call fibrin glue, which basically is genetic material or like material that works in your body to adhere or clot to hold pieces together.
Mhm.
And there's a dissolvable stitch to anchor it initially so it can heal that way.
Mhm.
Now, granted, it's not a guarantee with nerves because sometimes nerves do crazy things, but hopefully that it will grow into the other nerve as it grows and will not develop another neuroma.
Mhm.
When I've hit this area of my hand before, it has brought me to my knees and tears to my eyes. Um, it's like the only way I can describe it is like 1,000 times worse than hitting your funny bone is hitting directly on a nerve, and I just can't explain it. So this was to alleviate that from ever
Mhm.
being a problem, hopefully. And she did what they call a release of the nerve at the elbow and in the carpal tunnel region of the wrist. And there was moderate compression on the elbow and some at the wrist as well. And there's another area in the hand called Guyon's Canal where sometimes things get kind of compressed and stuck. And so she also looked at everything through there. And after they release everything, they also check the nerve in different movements of your arm to make sure that the nerve conduction
Mhm.
still goes through like it's supposed to. And it did. And so today I had stitches removed in my hand. There were 17.
Wow.
And it's going to be a very big scar.
So the dissolvable one is inside of
Is
your hand.
inside of the
Yes.
hand, yeah.
Okay. Mhm.
And I did not realize until today that there are dissolvable ones in my elbow as well,
Mm.
covered with steri strips, which is kind of like those butterfly strips
Mhm.
that people see and use.
Mhm.
And so those will dissolve. And eventually those strips will fall off as I'm able to get them wet
Mhm.
and they'll peel back. But it's about a 2-inch, 1.5 to 2-inch area that was cut through there.
Mhm.
And so hopefully down the line, this will alleviate the daily pain
Mm-hmm.
that I was experiencing.
Yeah, so we'll have to do a
A fall.
follow-up in a year and see how.
Right, exactly.
I think it's interesting in surgery, especially my only experience with surgery is a C-section, but in surgery where they're like, or even after just natural childbirth, like, oh, 6 weeks and you'll be back to normal. And I remember being like 20, very young with my first, and saying, actually, we're going to redefine normal. So,
And I think, I mean, with an amputation, that's what you're doing. You're
Mhm.
redefining your normal.
and to say 6 weeks, no, years.
Yeah.
Yeah, especially with nerves and everything.
With nerves, yeah. And so, she even said today, Dr. Shu did, when I talked to her, that it'll take a lot longer than, like, I have a follow-up in 6 weeks just to make sure healing's okay. And she said it will take longer to know
Mhm.
about the nerves specifically
Yeah.
over time.
Yeah, because the human body is pretty amazing.
Yeah.
But it also does what it wants.
It does what it wants sometimes. Yeah, exactly. And so, their big thing was nerves have a mind of their own. So just
Mhm.
realizing going into it is it may not be this magic fix, and having that in your mind as what expectations are
Right. Yeah.
afterwards.
So, I do want to celebrate you because you fast forward from your experience of saying that you had a peer support person. You're now peer
Yeah,
support.
I am now a peer support person. And I think, speaking to initial peer visitor had a
Mhm.
big part to do with that, is I wanted to be able to help others through like that emotional struggle, and maybe tell them what it was like and what it could be like. And I mean, just not to give up on yourself.
Mhm. Yeah, and that the morning of the plans you've lost,
Right.
like
Yeah.
you're like that life doesn't look the same
Right.
as I thought it
And
was.
again, one of my biggest fears is I went to school for all that time to do the career that I do now. And is this going to be something that stops me from being able to do that? And that was a big, big fear I had.
Mhm.
But then talking to her, and then going to the amputee center and talking to others, I realized it didn't matter. Like, I was still going to be able to do
That's
what
important.
I'm doing.
Peer support. That's what I always hear from the top, from Amputee Coalition and from research.
And because there's not other resources out there. Like, there's not enough to like tell you
Mhm.
about everything that could be or may be.
Mhm. Well, I think, and I've always say, like, I'm the executive director of the Amputee Center, and I've dealt with a lot of trainings for trauma, and trauma informed trainings, that you can do everything you can do, but until you connect with somebody who's had an experience, it doesn't help the human as much, until you can
Right.
connect.
And I've also said the same thing before, is I had a lot of support. I did.
Mhm.
I had a lot of support from my family. The only family experience with amputation was like a toe
Mhm.
from diabetes and a couple.
And that's so huge to say that because some people don't go back into a world that's supportive.
Right. And
So,
but they didn't have issues, right? Like, I mean, not issues that were talked about, or like they were able to live their lives okay with what they were given
mhm,
after
mhm,
the amputation of the toe.
mhm.
And they were both related to diabetes, and so neuropathy and not having sensation is a whole different experience than what I was experiencing. So everybody, again,
Like the peer
everyone,
support gets specific to,
right?
yeah, to your
Everybody
level.
told me, I think you'll be fine, or I know this person that does all these things and they're missing two fingers, and it's still
Sometimes that's not what you want to hear.
right. I don't know, right? And like, I will say that they never said anything bad about how awful my hand looked when I was excited about it getting better, even though it still looked pretty rough. No one said it still looks bad. No one was like in my face. I'm like, thank you for just letting me say I was happy that it was improving. But it was never negative from my family or
Mhm.
friends even, but it just wasn't the same as talking to somebody who had an experience with it themselves.
Mhm. Yeah. I think this is why we're here. This is
Yeah,
why we're recording the stories.
absolutely.
It's so specific of, you know, where did you work? What did you do before? What can you do differently? Did you have to make an adaptation? So So I want to talk because you've mentioned it a couple of times, and it's funny, not until you were speaking that I realized that then it would have been 2022, and I was teaching at the amputee center, and I was teaching a Saturday aerial
Mhm.
yoga class, and you paid to come to the
Yep.
class, and at the end of the class, you looked at me and went, "I'm an amputee," and I looked down at your feet. I was like,
Yeah.
"Wait, what?" And so that coming into the space and thinking of the seeing your journey of coming into fitness classes that even before your loss you wouldn't have even come to,
Right.
doing
And I will
yep.
say I have zip lined. And it
Mm.
was something I always wanted to try, but I didn't do that until after amputation.
Yeah.
So it's kind of wild.
And to the peer support that we provide of going and doing activities, finding a new tribe of people to go to a
Yeah,
concert,
to hang out
to
with,
do
right? Yeah.
something, and
So you're
finding
not at home by yourself just thinking about
mm,
things. Yeah, it makes a big difference.
that weird camaraderie of like, well, this is what we're doing, and we're showing up to support each other, and but to see the journey that I've got to witness of you coming into the fitness class and being active at the center and helping, and you being a certified peer support specialist, like to be able to know that when we get these calls and that it makes my job easier, and I feel like when I go, so I can only do so much, but I know that you're somebody that especially because of your training, because didn't you minor in psychology?
Psychology.
Yeah.
Yeah.
Yeah, so I love that I know if you're the one that's calling somebody looking for
Right.
support. So you are vital to the amputee
Well, thank
center.
you. I appreciate it. I
Yeah.
haven't been around as much because I'm not living locally at this point, but I
Mhm.
do hope to be back
But
soon.
the
But
virtual
still,
part is so important.
absolutely. I mean, I think as much reach as you can get is important for people
Mhm.
too.
Yeah, so to be able to get that feedback and to see of a fairly young nonprofit, being based in West Virginia and hearing your
And I mean,
experience.
that was kind of amazing to me to know that it was in Parkersburg, West Virginia to begin with.
Where
That
you moved before your amputation.
right, exactly. So how serendipitous was that?
Yeah.
Again, it kind of felt like I was just in the right place. And I think it's worked out well
Mhm.
overall. And I don't know how else to explain it except I was meant to be
Mhm.
meant to be where I'm at.
Absolutely. We are grateful that and that you came to the center, but I love that part of the mission of the center is that we offer community classes to anyone of any ability, and that was
What
your
brought me
avenue.
in.
Yeah, that was your avenue to step in first and not have that, I'm here because I'm an
hmm
amputee. I'm here and I want to try something. And then I've worked really hard so that we have adaptive instructors so that when that happens in the future, because it's going to, that we'll be able to make changes and adaptations for people. And what we don't know, we can ask
Right.
and we can,
Yeah, and learn and figure out something,
mhm,
right?
yeah, yeah, which is all part of the process, especially with um, amputations are as different as each person. And
Oh, absolutely. Yeah.
so another hand amputee might come in with a completely different experience.
Yeah.
But we'll at least because of you be able to say, oh, we know where to start with you.
hmm
Um, so so yeah, I like to focus on you know, the life, the journey, the trauma, and really saying that like being able to get you at this point in the middle of your journey,
Right.
hopefully towards the end of it, and you'll be able to cruise a little bit with
Right.
less pain.
hmm
My I guess my follow-up question to that was, did it impede your work? Like that was your fear? Like when you did go back to working with patients?
So it's kind of wild again how the brain works, how the body works, and as far as I had a concern about being able to type like I
Mm.
did for all this documenting, which is a lot of the job, half the job at least. And my brain just like automatically did it to where my ring finger would
Mm.
hit the buttons my pinky would hit before, and it didn't slow me down.
Mm.
And that was, I
Mhm.
mean, a great thing, but something I didn't expect. But it was kind of like a muscle memory automatic thing that happened.
I think one time you told me, like sorting change in your hand and the coin started to drop, and you were like, wait, no.
Yes. And so other things, right, you see and you think about, but you don't think about until it happens. Yes, I did. I got change back from a cashier, and like I with my right hand and I closed my hand, but the coins fell out the bottom because my pinky finger wasn't there. And I'm like, I'm sorry. Or I think she said sorry. And I was like, no, it's okay. I don't have that finger. And she's probably looking at me like I'm a weird. She just went along with it. But I know. I was like, no, it's not your fault.
And that's the stuff that, you have to just laugh about.
Right.
Wow,
Yeah. I mean,
what a silly thing.
trying to brush something off the table, I realize there's not as much. Can't do it with my right hand for the same amount of space as I can with my left hand because I don't have that extra length anymore on that side of my hand. But those are some of the unusual kind of funny things that happen.
Mm-hmm. I think my take on your experience is the of course, thank goodness you have such a great family and support and the people that were in your life stayed in your
Right.
life. But what is daunting, but also what I tell people, like in your day, like you hear this podcast or you meet an amputee, like stop for a moment and think about who's in your life and who would be able to support you if something changed in your life, or are you surrounded by
The people,
the
yeah.
people that you would want beside you if your life changed quickly? And if you're not, start doing things to get yourself there because
You just don't know, right?
you'll know.
It happens in a
Yeah.
split second kind of thing.
Yeah, checking in with like who are my deepest, strongest relationships, and are they going to be there for me if I need them? And I think a lot of us would be like, oh, maybe not.
Yeah.
Maybe I should reassess this or work harder to build those relationships. And the only way that you can do it is just to be there for people too. But I have heard this a lot from the Amputee Center, is that, because of the way we come together with that thread of trauma,
Right.
that it's a whole new group of friends that you have now.
Well, it is. Yeah. I mean, and it's wild because it's a situation where you go in and no one's like immediately, what happened? What happened to your leg? What happened? Or just staring.
Mhm.
Whereas sometimes you're out in public and that maybe this is something that people
Mhm.
immediately notice first, right? And that's all they focus on.
Mhm.
But it's not
Mhm.
when you go to the amputee center because everyone's familiar with it.
Yeah, I've had people lean in and say, "Well, what's their story?" And I go,
Like that curiosity thing, people just want to know.
and I'm like, I actually don't know because I've just been meeting them as the human they are.
Right.
And if the story comes out in conversation, it's fine.
Then
But
that comes out, right?
yeah.
But otherwise, just asking about it is not something.
Which is
I
the
would typically do it.
inspiration of this library, and that this is a lot. This is emotionally exhausting. You're
Oh, absolutely.
talking through it all. You'll probably need a nap later.
Yeah, I was gonna say even years later, right? I mean, it's just for me, it's like it just happened. Like if I think about it, like it's very vivid in my mind, the whole experience, like from that day.
And the empathy that you have for anyone who comes as your patient now, you'll be like,
Yeah.
yeah, like I can fix you up in 15 minutes and do the thing you need right now, but I understand that this
Right.
is now a lifelong journey for
Right.
you. And that's priceless.
Yeah.
To be able to connect and empathize with people in that way. So if you could give some advice to an amputee in your similar situation, with all of the ways that you ended up here today, what would that be?
I mean, if you can find someone that you can talk to, it is the biggest thing I think that really changed my outlook, generally speaking. But try not to be so hard on yourself. Like if you have to do something differently or you can't do something at first, it doesn't mean you won't be able to. It may look different, but you should still try it and see how you feel about it, if nothing else.
And keep searching.
Yeah.
And listen to your pain. 'Cause
Yeah. Oh, absolutely. Yeah.
coming back years later, here you are.
Right. Never thought about it. No one ever mentioned it, but here it is, right? The pain that became chronic pain that I just never expected.
Well, we're grateful for you, and thank you so much for coming today.
Thank you.
Thank you for listening to this episode of My Missing Piece. Be sure to like and subscribe on your favorite podcast platform and join the conversation. Let's rewrite the narrative together.